Alrighty, so today we're going to be doing the complete head to toe assessment. I've introduced myself to the patient, washed my hands. So today we're going to start off with the head, ears, eyes, neck, and throat. So the first thing we're going to do is assess the skin of the head and the facial area for color, texture, moisture, any edema, turgor, temperature, lesion scarring, nevus, anything like that. Everything looks good. So the first thing I'm going to do is just palpate bilaterally for the temporal pulses. Good, and like a good +2 pulse has been felt bilaterally. So next thing I'm going to do is just palpate for the lymph nodes. So we're going to go ahead and palpate the preauricular, postauricular, occipital, submental, or submandibular, submental, the anterior cervical, posterior cervical, and supraclavicular. Okay, everything felt normal. Nothing was tender or swollen, anything like that. Next thing we're going to do is move on to the facial nerves. So first thing I'm going to have you do, this is for cranial nerve 5. I'm just going to have you bite down for me, just assessing the masseter, palpating the masseter. Good. I'm going to have you shut your eyes for me real quick. Just say yes whenever you feel something.
Yes, yes, yes.
Good. And I would repeat that maybe with something more sharp. Next thing I'm going to have you do is smile real big for me. It's cranial nerve 7. Frown for me. Good. Puff your cheeks out real tight. Good. Yeah, and that's good. Okay. Okay, so that is, good for the head. All right, so now we're going to move on to the to the ears. So the first thing I'm going to do is assess the ears for midline. Make sure they appear, there's no deformities, anything like that. I'm going to pull on the tragus and the pinna. Good. Assess for any tenderness. Nothing was noted. The next thing I'm going to do is just look into the ear. I'm going to take my pen light. I'm going to pull up and back. Oh, it's not even turning on. Okay. So what I'm going to be looking for is I'm going to be looking at the ear canal. Really assessing for any fluid, any tenderness, inflammation. I'm also going to be looking at the tympanic membrane. A normal finding is pearly. Should be relatively translucent, no fluid, no inflammation there. The cone of light in the right ear should be about 5 o'clock, left ear 7 o'clock. I'll repeat that process bilaterally. Now we're going to move on to just like the hearing tests. First thing I'm going to have you do is cover this ear for me. Okay? And then just repeat back to me what I say.
Baseball.
Good. I'm going to have you do the same thing on the other ear.
Stocking.
Okay, good. It's the whisper test. Now we're going to do the Rinne test. So we're going to pretend this is a tuning fork. I'm going to strike this tuning fork. And basically what I'm going to do is just tell me when you no longer hear the vibration. I'm going to place it on the mastoid process. Oh, also, before I do that, I'm going to palpate the mastoid process. And percuss. Good. Any pain there? No. Okay. So I'm going to strike this tuning fork, place it on the mastoid process. Tell me stop.
Stop.
Just say stop. Okay. I'm going to strike this tuning fork. I'm going to place it next to your ear. Tell me stop when you no longer hear it.
Stop.
Okay. So basically, air conduction should be about 2 times that of bone conduction. Okay, just want to make sure it's running. Okay, good. Now we're going to do the Weber test. So this is going to test for lateralization. I'm going to strike this tuning fork, place it on your head. Just tell me where you hear the sound. Say both ears.
Both ears.
Okay, so it shouldn't be heard in one ear or the other. It should be heard. The vibration should be heard in both ears for proper lateralization. All right. So now we're going to go on to the eyes. So first I'm going to inspect the eyes. I'm going to assess for the eyebrows, the hair, the conjunctiva, any lacrimalization. I'm going to have you look up for me. Good. Look down for me. Good. Assess the palpebral fissures. That looks good. Yeah, so now what we're going to do is just do some of the vision tests, okay? So I'm going to have you cover your right eye for me and just hold that out and read that to me. Or just read that.
AEXYCHVD.
Good. And we'll just repeat the other eye.
AEXYCHVD.
Good. Okay. So that test was good. I'm going to have you just follow this pen to your nose for convergence. Good. Okay. That looked good. Now I'm going to have you look at me and just keep looking at me and assess and just tell me what I'm holding up.
2,
Mm-hmm.
3, 3,
Mm-hmm.
2,
Mm-hmm.
1.
Good. So she was looking at me the whole time. I was assessing for her peripheral vision, and she got everything right, which is good. Now I'm going to assess the extraocular field. So just follow the tip of my pen. I'm just going to assess for extraocular movement in all the vision fields. Good. And I didn't see any extraocular movements, so that is a good sign. So now we're going to pretend I have this pen light. I'm going to have you cover up one eye for me. Okay. What I'm going to do is shine this light in her eye. I'm going to make sure the pupil constricts and accommodates. I'm going to have you remove this hand. Good. So basically what I'm doing is making sure both pupils were accommodating and constricting appropriately to the light. So yeah, that part is good. Now I'm going to take my pen light and I'm just going to look into the eye, and I'm going to look into the retina. I'm just going to look for any like foreign bodies, any arterioles, anything like that. So macules, anything of that nature. And I don't see anything. So next thing we're going to do is the mouth. So first I'm just going to take a look at her mouth, her lips. Open up for me. I'm going to take my light. I'm going to look at the teeth, the soft palate, the hard palate. Open up. Good. I'm going to have you stick your tongue out and say ah.
Ah.
Good. Okay. So I'm assessing the uvula. I need it to rise midline. I'm assessing the tonsils. Anything like that, which looks good. So before I do the mouth, I would assess the nose. So we're going to do that first before we continue on with the mouth. I'm going to assess the nose, make sure it's midline. Inspect for midline. I'm going to have you do a sniff test. So just cover one nostril for me. Good. And just tell me what's on my wrist.
Vanilla.
Vanilla. Okay, do the other nostril.
Vanilla.
Good. Okay. And now what I'm going to do is just palpate the maxillary sinuses and frontal sinuses. Good. No tenderness, no swelling, anything like that. So yeah, that is good for the nose. Just think. And then I'm going to take my pen light and look up into the nose. I'm going to assess the nostrils. Make sure everything looks pink, moist, no inflammation. Maybe look at mucus, crusted mucus, things like that. Everything looks good. Our airways were patent. Now we can move on to the mouth. So we already assessed the mouth, did the tongue, the palate, all that good stuff. I'm going to have you open and close. We're going to assess for TMJ. Good. Okay, so I actually did feel a slight cracking. So we might want to look into TMJ or anything like that. Any treatment for that. Let's see. We already looked at the throat, the uvula. All right, so we're gonna move on to the neck. All right, so I'm gonna make sure the trachea, I'm gonna palpate for the trachea midline. I'm also gonna assess the skin for color, texture, moisture, turgor temperature, any edema, lesion, scarring, nevus, moles. Everything looks good. All right. So assess the trachea, good. I'm gonna have you look that way for me. I'm gonna palpate for the thyroid. Give me a swallow. Good. Go ahead and look that way for me. Give me a swallow. Good. Okay, so I don't feel any masses or anything. All right, now I'm gonna palpate the carotid pulse bilaterally, one at a time. Good. Good. Okay. I'm also going to do the range of motion in your neck, so just look up for me, look down for me, look left, look right, look all the way right, like all the way left, all the way right. Good. Head back. Good. Okay. That looks good. All right. I think that's good for the neck. Oh, we're gonna auscultate for any carotid bruits. All right, so look that way for me. Take a deep breath in using the bell of the stethoscope. Okay, deep breath in, hold. Good. Exhale. Look that way for me. Do the same thing when you're ready. Good. Okay. Yeah, that is good. So that was a complete head to neck assessment. And now we're going to set up for, let's see, for the neck, or for the abdomen. So I'm just going to have you lay down for me over there, and we're going to bring the laptop with us. Okay. Okay, good. Here, just lay down for me. You just have to take off your shirt.
Lay down.
Yeah, just have to take off your sweater. All right. So one thing I forgot to have her do is just sit up for me really quick. This is one last step of the neck assessment. Just shrug against my shoulders. Shrug your shoulders against my head. Good. Okay. All right. So now what we're going to do is move on to the stomach. So I just need to have you flip up your shirt a little bit. Okay. And maybe fold that down just a little bit. Okay. Good. Okay. So I'm trying to get in view. Okay. So first thing we're going to do is assess the skin of the abdomen. So that includes the color, texture, moisture, turgor, temperature, any edema, lesion, scarring, nevus. I don't see anything like that. We're going to assess the contour of the stomach. Everything looks flat, healthy, nothing protuberant, anything like that. All right. So the first thing we're going to do then is get into auscultation. Okay. Auscultate first. Okay, so first thing we're going to do is listen to all 4 bowel sounds. Okay. Here, you can just pull your pants down a little bit. Starting with the right upper quadrant. Good. Okay, so bowel sounds were present in all 4. I did that with the diaphragm and the stethoscope. Now what I'm going to do is use the bell and assess for the arteries. So first we're going to start with we're going to listen for bruits for the aortic, renal bilaterally, iliac, and femoral, which would need to be below the pants. Okay, good. So we auscultated for all the arteries, and there were no breathes heard. So now we're going to go into palpation. So the first thing I'm going to do is palpate for the aortic. Good. Okay. Now we're going to do is palpate light to deep. All 4 quadrants. Go a little deeper. Good. Okay. Now what we're going to do is palpate for, I'm trying to get this back. Okay, so we're going to percuss for liver borders, okay? So we're going to go mid-clavicular. I'm going to get my pen, actually. Okay. So we're going to mark our liver borders here. Basically just going to percuss up. Good. Okay. I'm gonna. Good. Okay. Then what I would do is measure between the 2 distances, and then I'd percuss left to right for the other border. Good. Okay. So the total the total span should be about 3 to 6 centimeters. Okay, and that's what I found here. So that looks good. So now also what I'm going to do is I'm going to palpate for the spleen. Okay, which is on the left upper quadrant right here. Okay, and I shouldn't feel it, should not feel the spleen. That's a sign of inflammation. And I'm going to percuss for dullness, which I found it. And that's Trobe's point. So that's good. Then what I'm going to do is palpate for the lymph nodes of the abdomen. So I'm going to go ahead, the inguinal and the femoral, which would be below the pants. Yeah, so, and then I'm just going to percuss all quadrants for resonance. Good. Everything was resonant and appropriate, which is good. Okay, now we're going to do McBurney's point. So I'm just going to have you take a deep breath in. Good. Good. Okay. Yeah. So McBurney's point is in the right upper quadrant. So actually do that one more time. Inhale in. Good. Any pain? Good.
No.
Okay. So McBurney's point is in the right upper quadrant. There shouldn't be any pain there upon inspiration. And when I put pressure there, that's a negative sign. So that's good. Now we're going to move on to, let me make sure I did all the palpations. Yeah, I think that's good. Now we're going to move on to some of the tests. So first thing I'm going to do, or sorry, that was Murphy's sign. Sorry, not McBurney's point. Murphy's sign is right upper quadrant to assess for gallbladder inflammation. It's not McBurney's point. So first thing we're going to do, and we're going to move on to the tests. We're going to assess for McBurney's point, which is the right lower quadrant. We're located right here near the suprailiac crest. Do you have any pain there?
No.
No. Okay. Then we're going to move on to Rovsing's sign, which is rebound tenderness on the left lower quadrant. Pain here would indicate possible pain in the appendix or appendicitis. Do you have any pain there when I push down? No. Okay. Now Now we're gonna move on to the psoas test. So I'm gonna have you lift your right leg up. I'm gonna apply pressure right below the right knee. Or keep your leg straight when you pick it up. Pick it up, go ahead. Good. Any pain in the right lower quadrant? No. Okay. Now we're gonna do the obturator test. So I'm gonna have you pick your knee up for me. Good. And kind of rotate in. Good. Rotate out. Any pain in the right lower quadrant? No. Okay, good. So all tests were negative for the appendix, ruled out all that. Yeah, so I think that's it for the abdomen. All right, so now we're gonna do the cardiovascular. So I'm gonna have you here. We gotta go back over here. All right, here, have some water. All right, I'm gonna start by just having you face this way. Okay. I need the. Okay. All right. So first thing we're gonna do now, we're gonna move on to the cardiorespiratory portion. So first thing I'm gonna do is inspect the posterior back for any color, texture, moisture, turgor temperature, edema, lesions, scarring, nevus, moles, anything like that. And everything looks good. So I'm also just going to inspect just the musculature of the upper back, the shoulders, scapula. Everything looks good. I'm also going to inspect for any respiratory distress, which includes tachypnea, nasal flaring, shortness of breath, wheezing, cyanosis, or tripoding. I don't see any of that. I'm also going to assess for breathing, pattern, rate, rhythm, depth, and yeah, anything like just normal breathing. Use of accessory muscles, right? And all of that looks good. So now I'm going to move on to palpation. So I'm just going to have you take a really deep breath in for me. Good. And so her lungs expand symmetrically bilaterally. Now we're going to move on to tactile fremitus. So I'm just going to have you say 99.
99.
Good.
99.
Good.
99.
Good.
99.
Good. Okay. So all that was good. Now we're just going to go on to, now we're going to do diaphragmatic excursion. Okay, so I'm going to, hello. Okay. All right, so I'm going to have you take a deep breath in for me. Hold it. Good. All right, and breathe out. Good. Deep breath in for me. And all the way out and hold it. Good. Good. Okay, so the difference is about 4 centimeters, which is a normal finding for our diaphragmatic excursion. So that is good. Lastly, we're just going to percuss for CVA tenderness, okay? So I'm just going to tell me if you feel any pain.
No.
Any pain? Any pain there?
No.
Good. Okay, so there's no inflammation of the kidneys noted, which is good. Just percussion. Now we're just going to percuss all the lung fields bilaterally. Good. Everything sounds resonant. Okay, now we're going to move on to auscultation. All right, I'm going to assess all the lung fields. So just take a deep. Sorry, it's cold. Take a deep breath in for me. Good. Out. Good. In. Good. Out. Good. In. Good. Out. In. Good. Out. In. Out. In. Good. Out. All right, we're going to get this anterior lobe. Another deep breath in. Good. Good. One more. Good. Good. We got all the lobes of the right side in while we were there. Okay, now we're going to move on to bronchophony. So I need you to say 99 every time you hear the stethoscope reposition. So this shouldn't appear or shouldn't sound louder, because if so, that would indicate that there's fluid, because fluid sort of makes sound louder. So we're going to look for a normal finding there. Say 99.
99. 99. 99. 99. 99. 99. 99. 99.
Good. Now we're going to do the egophony test. So what I need you to do is just say E every time you hear me reposition the stethoscope. And so an abnormal finding would sound like A, and that would also indicate fluid. Let's go ahead and say E.
E. E. E. E. E. E. E. E. E.
Good. Okay. Now we're gonna do the whisper pectoriliquy exam. So again, she's gonna whisper. I'm gonna put my stethoscope up to there. It should not sound any louder in the stethoscope. That would indicate fluid. So just say 1, 2, 3. Whisper 1, 2, 3. Good. Okay. So I did not hear any louder sounds, which is good. So yeah, I think we did just about everything. So now what I'm gonna have you do is just turn around for me. We're gonna do the other side. So before we begin, I'm just gonna inspect the anterior chest, once again for color, texture, moisture, turgor, temperature, any edema, lesions, scarring, nevus. Everything looks good. I'm first gonna just palpate for lung expansion bilaterally. Go ahead, breathe in and out. Good. That was good and symmetric. I'm just gonna do some brief tactile fremitus. Just say 99.
99.
Good.
99.
Good.
99.
Good. Okay. So I felt the vibration on my ulnar surface, which is good. Yeah. So that is good. Now what we're gonna do is oscillate just some of the lung sounds. Just take a deep breath in. Good. Deep breath in. Out. Good. Go ahead. Good. 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 Okay. So now what we're going to do is oscillate for some of the heart sounds, and I'm going to use the bell of the stethoscope first. Okay, so we're going to use the apical first. Just breathe normal. Pulmonic. Erb's point. Tricuspid, which would need to be under the breast. And mitral, again, would need to be under the breast. Good. I would repeat that with the diaphragm of the stethoscope. What I'm also going to do is just feel for the apical pulse, PMI. Good. Okay, so that's between the 4th and 5th intercostal space left mid-clavicular line. And I felt that, which is good. Yeah, I think that's it for seated anterior front. So now we're gonna have to go back to the couch. All right, if you want to go back there, I'll set everything up. And Boo is right there. No. So yeah, just lay flat for now, actually. Okay, I think that's good. Oh my gosh, she's right there. Okay, all right, so that's good. Good. Okay, so first thing I'm gonna do is inspect. Okay, is that good? Okay, so
I think you should move it.
move it over. Okay. Yeah. Okay, so I'm gonna inspect. Okay, so I'm gonna listen to all the heart sounds again, with the bell and then the diaphragm. Well, we'll do the diaphragm first. So the apical, pulmonic, Erb's point, tricuspid, under the breast, mitral, so under the breast. Repeat using the bell. Do that through all 5 sites again. All right, and then also what I would do is first I'm just gonna inspect for any lifts or thrills, and then I'm gonna palpate for any heaves using the ulnar surface of my hand. Good, I'm gonna have you sit up a little bit more for me. Yeah, just prop up, there you go. Look that way for me. Okay, and now I'm just gonna inspect the neck. I'm looking for any jugular distension. Turn all the way that way for me, good. And it should just be like slight like dimpling in the neck. I can actually visualize it right now, which is a good normal sign. So that looks good. Oh, okay, now I'm just gonna have you just sit, put your feet on the floor for me real quick. We're gonna listen to the PMI while she's leaning forward. The bell. Okay, lean forward for me. Just take some deep breaths. Just quiet breaths. Breathe normally. Okay, we need to go under the breast. Normal breaths. Normal breaths. Okay, good. Now I'm just gonna have you lay on your left side for me real quick, and we're gonna listen to PMI one more time as she's laying left lateral decubitus. Okay, the cat is in the way. Left lateral decubitus. We're listening to the PMI. Okay, good. All right, so now we're going to move on to the musculoskeletal. That is it. Wow. All right, so for this one, why don't we... How did we do it last time?
I don't know what it was.
All right, we're going to start by... We'll do it right here. Okay. I need to sit where she is, but, just sit right... Yeah, there you go. Okay. Sit right there for me. Okay. All right, so now we're going to do this musculoskeletal test. All right. So here, let me just get my things. Okay. So the first thing we're going to do is assess the fingers. We're going to look for any redness, deformity, swelling, any tenderness, nodules, crepitus, symmetry, and everything looks good. I'm going to inspect for capillary refills bilaterally. Here, flip your hands over for me. Good. Good, and the color returns almost instantly, so that's good. I'm gonna have you squeeze my fingers as hard as you can. Squeeze, squeeze as tight as you can. Good. 5 out of 5 strength. And now what I'm gonna do is just test the range of motion for your fingers. So flex your fingers down like that. Good. Extend them like that. Abduct them like that. Adduct them like that. Good. Okay, and that's good for the fingers. Okay. Now we're going to move on to the wrists. So we'll do the range of motion first. So flex your wrists down like that. Extend them like that. Deviate your ulnars like this. Good. Deviate your radius like this. Good. Circumduct your hands like this. Circumduct them like that. Good. I'm just gonna have you flex your hands down against my resistance. Go ahead. Good. Flip them over. Same way. Do the same thing with your wrists. Good. Good strength. I'm gonna palpate the radial pulse bilaterally. Good. Feels like a +2, which is good. And now what I'm gonna do is we're gonna test the ulnar process. To see if she can feel it for vibration. So we're going to pretend this is a tuning fork. Strike this tuning fork, place it on the ulnar process. Do you feel the vibration?
Yes.
Good. Okay. So now we're going to move on to, so for the wrists, what we would also assess for is the redness, deformity, swelling, any tenderness, nodules, crepitus, symmetry as well. Now we're going to move on to the elbows. We're going to assess for any tenderness, redness, deformity, swelling, crepitus, nodules, symmetry. I'm going to have you flex your elbows like this. Good. Extend them like that. Good. Okay, now do it against resistance. Good. And do the other way. Good. Okay. So that was good for the elbows. Now we're going to move on to the shoulders. Again, for any redness, deformity, swelling, tenderness, nodules, crepitus, symmetry. Before we move on, we're just going to test the upper extremities just for feeling nerve sensation. So I'm going to close your eyes. Just say yes when you feel a touch.
Yes. 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 Yes.
Good. Okay, that was good. So now I'm going to have you, you might have to stand up, but flex your shoulders like this for me. Extend them back like that. Good. Circumduct them like this. Circumduct them like that. Adduct them like this. Abduct them like that. Good. And then abduct them, push them down against my resistance. Good. Abduct them against my resistance. Good. All right, so that was good for the shoulders. Now we're going to move on to more of the neuro tests. So the first thing I'm going to do is have you do like that, tap each finger. Good. Flip-flop your hands like this as fast as you can. Good. Now we're going to do the graphesthesia. I'm going to have you close your eyes. I'm going to write a number or letter in your hand. Tell me what it is.
H.
Good. And the other hand.
T.
Yes. All right. So now we're going to do this stereogenesis. I'm going to place an object in your hand. Close your eyes. I'm going to have you tell me what that object is.
AirPods.
Good.
A pen.
Good. All right. So that's good for that. Okay, so now we're going to move on to deep tendon reflexes. Okay, so first thing, I'm just going to try to, so we would repeat everything bilaterally. Okay, that's the brachioradialis. Biceps needs to be dependent. Good. Triceps. Okay, the triceps reflex. We're going to do so it's going to be hard to assess this because she's seated at the floor, but I would have her sit up where her leg is laying dependent. We would do the patellar tendon. We would then do the Achilles tendon, but her leg again would need to be dependent. We're looking for almost like a jerking flexion motion of the foot. And with the knee, the patellar tendon would be like a little jerk forward. We're also going to do the Babinski test that we can do. I'm just going to have you take off your shoes. Okay. All right, just let's do this leg, sorry. Just take that off, good. Quite a bit of fuzz, good. Okay, that was a normal, how her foot opened like that, that is normal. Okay, you can put your foot back in. Good, okay. Did the shoulders, now let's do the hip. So I'm gonna have you lay down for this, actually.
Where, that way?
Oh, actually, no, this way, sorry. Prepare your pillows.
Just one.
Okay. Lay down. Okay. So I'm gonna have you here, straighten your legs out. Okay. I'm gonna have you straighten them out. I'm gonna have you flex your hips by bring both knees to your chest, kind of like that. Good. Actually, just pick your legs straight up as well. Good for flexion, hip flexion. I'm gonna have you evert your hips by bringing your leg like that. Good. That's invert the hip, evert your hip. Good. Same way. Invert your hip, evert your hip. Good. Okay, now lay on your stomach for me real quick. Okay, good. And now I'm gonna have you extend your hip by bringing this leg straight up. Good, and do the same thing with this leg. Good, okay. Yeah, so that's good for the hip. Now I'm gonna have you sit right here. We're gonna do the knee. I'm sorry. Oh God. Okay. I'm gonna have you, again, it'd be ideal if she was laying dependent. I'm gonna have you extend your knee like this, put your leg straight out. Good. And then flex your knee, bring them back towards you. Good, that's knee flexion. Yeah, just invert your knee like this. Good, evert that. Good, same way with this way. Evert, good. Okay, I'm gonna have you extend them against my resistance. Good, and flex them against my resistance. Good. Again, she needs to be seated dependently for that to be appropriately tested. Now we're going to do the toes and the ankles. And again, for each joint, we're assessing for redness, deformity, swelling, tenderness, nodules, crepitus, symmetry. Okay, so for the toes, first thing we're going to do is assess for that. I'm going to have you flex your toes down. Good. Extend them. Abduct them. Adduct them. Good. I'm going to assess bilaterally for capillary refill. Good. The color returns immediately. I'm also going to do, I'm going to strike this tuning fork. I'm going to place it on the malleolus muscle. Well, I wouldn't be holding her leg, but she would maybe be just laying on a table or laying with her leg dependent, sitting up with her leg dependent. Do you feel that vibration?
Mm-hmm.
Good.
Yeah.
Okay. I would do that bilaterally. I'm also going to do the pulses. So the first thing we're going to do is the dorsalis pedis bilaterally. Good. The malleolus. Posterior tibialis. Which is good. And then the popliteal, which is in the back of the kneecaps. We would not be doing this over clothing. Good. Okay. Now I'm going to assess the ankle joints. So if you can put your feet back up. All right. Flex your ankles down for me. Good. Extend them up. Circumduct them like that. Evert them, just point them out. Invert them, point them in. Good. And circumduct them one more time. Good. Okay. And then flex down against my resistance. Extend up. Good. Okay. I think that's it for the feet. And now if you stand up, we'll assess the spine. Go ahead. All right. So maybe I'm just push that back. Back towards the wall even. All right. So I'm gonna have you here face me. I'm gonna have you flex down for me. We're gonna assess the spine for curvature, any deformities or anything like that. So it looks good. So you can extend up. Good. Extend your spine back. Good. Circumduct your spine like a hula hoop. Good. Okay. Lateral flex this way. Lateral flex that way. Good. So now we're going to do some more neuro exams. So the first thing we're going to do is just do a deep knee bend. Yeah, a deep knee bend for me. There you go. I know, I'm sorry. Almost done. Okay.
A what?
Do a deep knee bend for me, like almost like a squat. Good, come up. I'm gonna have you, we're gonna do the Romberg test. So close your eyes, put your arms out for me like this. Oh, I'm sorry, put your feet together first. Close your eyes, put your arms out. Close your eyes. Good, just assessing for balance. Good, it's a negative test. Now we're gonna do the pronator drift, so do the same thing. Put your palms up, close your eyes, extend your arms, good. And we're just assessing to see if she has a tendency to pronate, and she does not, which is good. I'm gonna have you hop on one foot, now the other foot, good. I'm gonna have you walk, here, stand right there. Walk towards the camera on your toes. Good, walk back on your toes. Walk towards the camera on your heels. Good, walk back on your heels. And normal gait, just normal walk normal towards the camera and back away from the camera. All right, that completes the head to toe assessment.